How important do you think, Dr. Moreyra, is nutrition for patients to fully recover, and even if it's this possible to fully recover?
Yes, unfortunately, cartilage surgery is difficult in the sense that cartilage has a very poor healing potential. If you look at cartilage under the microscope, the cartilage sets are just basically very sparsely interspaced. Cartilage itself has no blood flow and it has no nerve endings. So problems with cartilage, are very slow to heal because they get the nutrition by diffusion. At least I'm talking about the cartilage that's on the diarthroidal joints, the joints like the knees, the hip, the shoulder, that type of cartilage. And so I think the best for that is basically prevention. And in the prevention, the primary mode is through nutrition, really. Sometimes people think, well, like, does running cause arthritis? The common belief is that it causes arthritis, but the evidence doesn't really show that it does. I think when it comes to, activities such as running and arthritis, it doesn't really cause it. Although if you do have problems with cartilage, you might have to modify your activities. And that's at least my personal opinion on that. The best thing is to prevent any problems with the cartilage. And nutrition plays an important role. And there are some studies that have come out in the last few years discussing, high levels of insulin in cartilage. And for instance, there was one study done in China that was published in 2020 that showed that high levels of insulin can induce inflammation on the synoviocytes, which are the cells on the joints that make the synovial fluid, or the fluid that bathes the cartilage. And so basically that study will, make you think, well, maybe if my insulin is lower, which will be by decreasing carbohydrates, my arthritis could get better. And there was a study done, I think that was published later that same year out of the University of Alabama in Birmingham, showing that a randomized controlled trial with a low carbohydrate diet decreases pain and improves function in patients with knee arthritis in comparison to those with a standard diet and in comparison to those with a low-fat diet, which has been the traditional recommendation from, U.S. Department of Agriculture through the dietary guidelines. And so now with those two papers, you have basic science and you have clinical results showing that a low carbohydrate diet can help improve the pain and function in arthritis. The other thing is to cut down on or eliminate vegetable oils. Now, this one's a little bit more tricky, and it's something that I've even been learning myself more in the last year or so, how it particularly applies to arthritis. And there are at least a couple of mechanisms that I have been able to figure out from looking at the literature. One is that vegetable oils, linoleic acid, which vegetable oils are high of, which is linoleic acid is omega-6 fatty acids. They tend to lead to the formation of advanced glycation end products. And these can be bad for the cartilage. Now, diabetes will certainly do that. And advanced glycation end products basically means you take a glucose molecule or some other molecule and you attach it non-enzymatically to a protein. And it changes the structure of the protein. For diabetics, it happens obviously with glucose. And what it does is that it makes tendons stiffer. They're not as elastic, and so they're more brittle. And so with injuries, they can tend to tear more easily. But advanced glycation end products can also occur in the face of a diet that is high in vegetable oils. And in fact, the incidence that these advanced glycation end products form is actually about 10 times higher than it would be with high glucose levels. The other way that I've been finding out that vegetable oils can be bad for joints is through oxidation of LDL or low density lipoprotein. So these can also induce cartilage destruction when you have oxidized LDL. Well, the way that LDL, low density lipoprotein, gets oxidized is through the consumption or a diet that is high in linoleic acid or these vegetable oils.
Doctor, are we talking about refined vegetable oils or all of them, including cold pressed oils?
Yeah, good question. I think if they're pressed, they're definitely better. The process The issue is, so I would say olive oil is okay. Problem is that with olive oil is that a study from the University of California at Davis showed that most of the olive oil, extra virgin olive oil sold in the United States is actually adulterated or even fake. And so they mix them up with other vegetable oils. And I know that's also been an issue in Italy, and in the national police in Italy, they have a department that all they do is prosecute agricultural mafia, and because they want their vegetable oils, their olive oils to be pure. So in the United States, most of the olive oil is actually adulterated with vegetable oil. So that's unfortunate. For things like cottonseed oil or soybean oil, canola oil, they get pressed, but then they get treated with hexene. They go through a refinement process trying to extract the oil from it. And this whole processing leads to oxidation. Then it sits in a bottle that it's clear under light, that gets oxidized more. And then you go to a fast food restaurant, and then they don't change the oil for a week. Yeah. And so they keep reheating it, and that gets it even oxidized more. But even inside the body, it can oxidize too. So there's probably a hierarchy of which oils are worse, but the worst one is going to be the one at the fast food restaurant that hasn't been changed for a week, then the fresher one, and so forth. I personally try not to consume any of these vegetable oils. I do use olive oil, but I try to get it from a particular brand that is reputable, that only gets it from one particular source. And so my olive oil comes from southern Spain, and that's the only source of it. They don't mix it up with oil from other countries. And I know there are websites out there that will discuss different brands, which ones are being shown to be pure. But yeah, pressed oil is definitely better than if it's has been treated with hexene or other chemicals to extract the oil, for sure.
I did a surgery at my right knee. The doctor that the operation told me that most of my cartilage is taken out, and I should not run anymore and do sports, because I will get arthritis or osteoporosis, or even a knee replacement prosthesis. Because I eat good fat, I eat vegetables, I do intermittent fasting, I do fasting with just water. What is your perspective regarding my knee, my recovery?
Well, not being necessarily medical advice, because I'm not examining you. I don't have your X-rays or MRI or pictures from the surgery. In general, I would say, if patients are able to do an activity that they should continue, that they can continue to do the activity. I have seen patients with so-called bone-on-bone arthritis, but yet they have no pain. And I do think that's possible. Again, cartilage doesn't have nerve endings. So a problem with the cartilage itself is not going to give the pain. So the pain is coming from somewhere else. Now, Is it coming from the bone, or is it coming from the nerve endings in the synovium? Those are the likely sources for the pain, but the cartilage itself is not the source of the pain. Now, with lack of cartilage, yes, you can have areas where the bone sees more joint reactive forces because it doesn't have the cushioning of the cartilage. So as the bone sees more joint reactive forces in one particular spot, then that can become a source of pain. And in some cases, patients can get what is called an osteochondral lesion, which is basically a fracture, but not a fracture like breaking a bone into two parts, but it's more like a little tiny compression of the trabecular bone that is on the immediate area of the joint. So I do think for that, or to prevent that, modification of activities is warranted. But in general, I think if it's something that the patient it doesn't bother to do them, I think they can normally continue to do it. But there are differences. It depends also on the alignment of the knee. Some people have knees that are varus aligned, and varus means like bow-legged, where the knees are like sticking out, the feet are sticking in, and so that can create increased pressure on the medial side of the knee. So you have to kind of take all that into consideration, though. But things like nutrition help. Cutting vegetable oils help, because as I recently learned, they can lead to destruction of the cartilage via oxidized LDL, and then cutting down on sugars so that you don't have high levels of insulin inducing inflammation from the synoviocytes, from the fibroblast-like synoviocytes, but still being able to do some sort of weight-bearing activity, because in order to preserve bone, you need to have weight-bearing activities. And a good one is walking, but I personally feel that walking, although it's good, is not enough for to preserve bone mass. And I think it's common to see, some women who are walkers, postmenopausal women, that are still having osteopenia or some osteoporosis. And so I do think it's important to put some strength training into their exercise regimen to help prevent osteoporosis. But in general, if somebody has some cartilage issues and certain activities don't bother them, then I'm okay with that. And I think that they can continue doing them.
Good to know. I believe that sports, whatever that is, should be done because after I use it, it just feels so good. My mind and body feels very good, and I believe very much in this part of the recovery as well. Because of the way we live, and we work today all day in the offices, and we sit down most of our time in our apartments, we sit down, we tend to develop this back pain, upper body pain. Do you think this is also because of our nutrition, besides our lifestyle, like standing all day on the phone, or is it our nutrition does not play here a significant role?
I think nutrition plays a role in everything, but when it comes to our lifestyle, it plays a significant role too. And the sitting position, hunched over, looking down at a computer, doesn't really help. I think it's important to take frequent breaks. I think it's important to get out there in the sun. If it's even possible to have your lunch outside for people who work at a hospital, and I think that can help too. I think, how much of it is nutrition, how much of it is activity or lifestyle in terms of our everyday work, it's kind of hard to tell, but I do think that they do both play a role. Some things that we do, we're just so used to it that we don't tend to think that it is a problem, but even being indoors all day can be a problem. I mean, as soon as we finish this, I'm going to go outside.
Me as well.
But so it's just, I think we have to sit back and analyze those things that we take for granted. We take for granted the fact that we're indoors all day working under artificial lights, not getting sun, sitting down on a chair all the time. And that's a problem because we need to be able to do exercises that help with our posture, with our core strength, weight-bearing exercises to help prevent bone loss. And these are things that we're not doing while we're working, at least for most of us that work indoors.
Well, if we try to tell, I have a friend that works in a physiokinetotherapy center, and if I always tell them, talk to your patients about lifestyle, about food, because recovery is very active and important once the patients leave that physiokineto center. How can they approach the patients since they are not nutritionist personnel? This is their excuse. I'm not a nutrition guy. I don't want to tell our patients nothing about food.
Yeah, I find that to be a difficult subject because the easy answer will say, well, we'll refer you to a nutritionist or to a dietitian or to your primary care provider. A lot of the information that those providers will provide is usually just the standardized dietary guidelines that are promulgated by the government. And I have found out those do not work very well. Mm-hmm. It can certainly help somebody who's on a standard Western diet, but if somebody's who's already been trying to eat healthier, but is still having a lot of metabolic health issues, I don't think that standard advice is going to help them. It could even make them worse. So I've gotten to the point where I don't refer any of my patients for nutritional advice. I do it myself. And I have dietary advice and bone health advice that I give to my patients. And I give them to almost all my patients. And I try to discuss it as much as I can during a very brief clinical visit. But I stopped referring just because I know what they're going to say, or at least for most of them, which is going to be standard advice of eating whole grains, lots of fruits and vegetables, stay away from saturated fat, stay away from meat. And I haven't really found that to be healthy. In fact, sometimes even quite the opposite. The grains are just going to fuel up insulin resistance, and almost everybody has insulin resistance out there. The grains also are going to be having a lot of glyphosates. They'll have a lot of lectins. They can induce gut-related issues. The red meat, for the vast majority of people, is not inflammatory, unless like one of the few people who can have an allergic reaction to it. And people have improved or reversed or put into remission their type 2 diabetes by eating mostly, meat and eggs. And so I've kind of moved away from referring for anybody for nutrition. I just kind of do that myself. And that has been part of my orthopedic practice for like about the last 4 years.
I'm going to send this interview to my friend that he's the manager of the Physio and Kineto Center, has a couple of recovery specialists under him. What would be your opinion, advice to him to instruct or to not instruct for his personnel regarding nutrition and also promoting a healthy lifestyle outside that center?
Well, I mean, they could work with a dietitian who understands the power of nutrition, who understands the power of a low carbohydrate or ketogenic diet for reversing diabetes. Maybe if they're able to find somebody who could see beyond the dietary recommendations of the government and can see where they could actually go wrong and how to improve the health of patients by eliminating carbohydrates, by eliminating omega-6s, by eliminating lectins. And I think they can work with such a dietitian or nutritionist to develop like their own nutritional recommendations. Or, what I've done, I just do that myself. And, is it at the risk that somebody might say, well, these are not approved by the medical staff of the hospital? Yeah. And I've had that issue where I've had to meet with administrators of hospitals to discuss my dietary recommendations, because the fact that they're not in line with what the hospital does. And, so there can be some resistance. You can get into some resistance, but, they could actually maybe just develop their own too. Basically, when it comes is elimination of highly processed foods. That's going to be universal. And, there's no perfect diet for everybody, but eliminating highly processed foods will work for everybody. Nobody needs to be any food items that are highly processed, okay? Like the ultra processed foods like candies and things of that nature, that is not a requirement for anybody. But, normally the authorities will say vitamin D and calcium, but vitamin D should probably be higher than what they normally recommend. I think 60 nanograms per milliliter of a 25 hydroxy vitamin D is kind of a goal, but sometimes even higher can actually be helpful too. Calcium by itself is a problem for postmenopausal women. If all they do is supplement calcium, studies shown that they just simply calcify their arteries and their soft tissues. So it's sort of like building a house. If you're going to build a house, you got to have all the ingredients and you got to pay the money to the contractors, because if you don't pay the contractors, it's not going to get built. Paying the money to the contractor is stimulating the body to make bone. And you do that through weight-bearing exercises, strength training. Okay, so that's a key too. You gotta have protein, adequate amounts of protein. The elderly are not able to absorb protein as well as younger people. And some studies have shown that when they add protein, it's better for the bone health. Several studies that I have looked at. Also, magnesium is important. A lot of our soils are depleted from magnesium from just agricultural practices. So magnesium may need to be supplemented, or at least to try to eat a diet that is high in magnesium. And vitamin K2. Vitamin K2 is very important for bone. It's very important for the management of calcium in the body. There are several forms of vitamin K2. So there's vitamin K1 and there's vitamin K2. Normally in medicine, we learn vitamin K as being K1, more involved with coagulation pathway. But there's some subsets of vitamin K. There's one and there's two. The one usually comes from plant sources, but the K2, it almost exclusively comes from animal sources. The only time when you can get K2 from plant sources is from eating like natto, which is Japanese fermented soybeans. And it's not even the soybean that has the K2, it's the bacteria that ferment the soybean that makes the K2. But other sources can be liver, pasture-raised eggs. And what K2 does, particularly like MK4 or MK7 variations of vitamin K2, is to help send the calcium to the bones and not send the calcium to the arteries or the other soft tissues. And so I think it's a combination, and there are other nutrients too, boron and so forth, but when you have protein, D3 in adequate amounts, probably best from diet and from the sun, K2, magnesium, along with weight-bearing exercises and strength training, I think that's good to help with bone density, particularly for postmenopausal women. And so I think my standard dietary advice revolves around that, along with the elimination of highly processed foods, because I don't think that was beneficial for anybody.